Is your doctor stopping your opioid pain medications, cutting them off after several years of treatment? I'm Dr. John, and this video channel, Shooting Up in the Dark, is dedicated to the topics of addiction, opioids, and chronic pain. And right now, let's talk about why doctors are cutting off opioid prescriptions from patients, what happens to people who are cut off, and what you can do to advocate for yourself and prepare for this scenario. This will be a relatively brief overview with more detailed content to be forthcoming. In the American medical culture today, there is much confusion and fear around prescription opioids because of the opioid epidemic, a realization and public dialogue starting about a decade ago that cases of addiction and overdose were increasing, and that at least to some degree, this was being driven by prescription opioids. Several years before that, in the late 90s to early 2000s, the medical culture was heavily impacted by the partly true but also largely abused notion that physical pain people were experiencing of several kinds, mild and moderate pain, but also more severe types of pain, were all being undertreated to a degree which meant healthcare providers were responsible or even negligent of their oath-bound duty to relieve pain. I say the idea was abused because part of what was behind it was the behemoth pharmaceutical industry pushing new opioid pain medications, such as OxyContin, which they touted as safe, and the willingness and complicity of the medical culture, leadership, oversight, and authorities. There is no doubt that this change was appropriate for many people who needed it, and today still need it, but could not, and as we'll see today again, cannot access effective treatment for chronic pain. Chronic pain affects 50 to 100 million Americans. At the same time, this change ended up liberalizing opioid use to the extent that there was injudicious prescribing, millions of pills ended up diverted and funneled to fuel abuse and addiction, and along with this came a spike in cases of noted opioid overdose deaths. Now, what actually happened is more complicated than doctors creating addicts and deaths, but confusion started building following by controversy, and by 2010, reaction to the data on the opioid crisis triggered a movement in opposition to opioid use. To be frank, doctors, at least the majority, never have enjoyed prescribing opioids or taking care of chronic pain patients. All through my training and years of practice, there was clear evidence of stigma, judgment, and misunderstanding throughout the medical culture regarding, quote, pain patients who were often equated with, quote, medication seekers or even with addicts, really without any true understanding of what addiction was, nor the dynamics and behaviors commonly observed in it, or about the long-term use of opioids. I often speak about how healthcare professionals and much of the system is ignorant concerning addiction and safe opioid use because during much of my 20-year career after training, I too was ignorant. I thought, judged, and acted based on this ignorance, and I never encountered any kind of education in medicine to significantly alter the assumptions and biases, mostly negative, which were passed along to me by my physician mentors. I had compassion, but I had no idea then what drug addiction was, where it comes from, how it develops, how susceptible anyone can be, how powerful it is, and how addiction hijacks the brain's reward and survival circuits, making stopping humanly impossible, how one could stop, or anything about recovery. Other videos on the channel address the multiple various issues arising out of the, quote, opioid epidemic, but we are answering the question here, why are doctors cutting off access to opioids? Specifically, access to long-term opioids prescribed for chronic pain. And related questions might include, what will happen to me when my prescription is terminated? Or what can I do to advocate for myself and get through opioid withdrawal in the aftermath? Even before the opioid crisis became prominent in the news, healthcare providers generally were cynical about prescribing opioids and taking care of patients with chronic pain who are on long-term opioids. While recognized by some as important, it became something more and more healthcare providers resented. Because of associated perceived risks and concern over creating addiction, but also because providing quality, safe chronic pain care with opioids was demanding, requiring lengthy medication contracts, and because patients with chronic pain generally had multiple medical problems and were challenging to care for. So while concern was building about opioids being overprescribed in general, more and more doctors decided to just no longer prescribe opioids, both in primary care and in pain specialist practices. Over the past few years, guidelines have been published by influential organizations like the CDC regarding opioid prescribing for acute pain and for chronic pain. And some of the guidelines have been misused, applied out of context, or generalized by organizations who provide physician oversight and have the authority to discipline them by acting on credentials needed to practice. Most notably, the DEA, or Drug Enforcement Agency, and state medical boards. Newer guidelines for prescribing for acute pain have been helpful and I think appropriate, as discussed elsewhere on the channel. The guidelines initially suggested for chronic pain have turned out to be a real problem, though, because if followed strictly, they leave a group of patients who really need opioid medications and often have used them successfully for years in a vulnerable position. There are 50 to 100 millions in this country with chronic pain, at least 25 million of them with severe chronic pain. Chronic pain is defined as pain lasting longer than 12 weeks and is a major cause of suffering, disability, lost work productivity, and mental health problems. For millions of these patients, opioids are the only kind of treatment which provides substantial relief, improves function, and allows these people to live a relatively normal life. What's happened over the past several years, while government and oversight organizations are trying to respond to the opioid crisis, is that the quote guidelines or suggestions published have been inadvisedly employed as rules or strict parameters on what dose of opioid medications doctors should prescribe at a maximum for chronic pain. Medical boards and the DEA have since used these arbitrary dose limits as a basis to intimidate, label, investigate, and punish physicians and all healthcare providers who prescribe. In some states, these dose limits have even been codified into law. What this has done is encourage more and more physicians to, in fear of their professional livelihood being compromised, stop prescribing opioids altogether, to the point where this is today a common stance of all kinds of doctors. Today there are towns and cities in which it is impossible for a person who has been helped by opioid medications in the past for their chronic pain to any longer find a provider who will prescribe for them. Now, there are many reasons why dose limits on opioids don't make sense when applied to everyone across the board, because there are vast differences in the required amount of opioid needed to affect pain relief, depending on the phenomenon of tolerance, how long the patient has been taking the medication, the fact that opioids are known to have no therapeutic ceiling, and medication sensitivities differing between drugs and patients. But this situation is unacceptable because it is harmful to millions of persons. It's driven largely by biased information traceable to an anti-opioid political agenda, and because data show that cutting off chronic pain care today is not having any positive effect on opioid addiction or overdose death. In fact, there is very good evidence that today more harm than good is being done. The medical community has begun to recognize the pitfalls associated with the current anti-opioid thinking and enforcement, but momentum is still driving the problem. As is obvious to anyone familiar with me and this channel, I take opioid addiction extremely seriously. It obliterated several areas of my life and has taken away persons I cared for. I am an opioid addict in recovery and personally aware of the devastation of addiction, which is perhaps worse today than ever. So in no way am I naive about opioid prescribing, nor do I condone injudicious prescribing. However, the anti-opioid movement in American medicine has become so extreme that people are actually being harmed. Some even pushed into the use of black market and illicit opioids as replacement for their medication in the aftermath of being cut off from any possible safe source of an opioid prescription. And the medical community, as I stated, is largely ignorant about the issues of drug addiction and about the long-term effect of opioids, particularly what is implied in stopping a long-term opioid prescription. It is noticing the damage done only very slowly, as most remained confused, perplexed, and misinformed. And this makes sense because these issues are not simple. They are actually difficult to understand until one has lived through them. My characterization of the masses in medicine and much of society as, quote, ignorant is not an attack, just a truth which applied to me as much as anyone before my experiences. It turns out that addiction is a form of insanity with subtle and counterintuitive aspects which can only be understood by listening to those who have lived through it. And the fact is that the vast majority of patients with chronic pain, often treated with opioids as the only or most effective option we have so far, are safe and actually healthier taking opioids. Research suggests that at most 10% and more likely 5% or less of persons using opioids long-term for chronic pain ever develop a problem with the medication or are sources of opioid diversion. What's more, cases of prescription opioid abuse, addiction, and diversion can be quickly detected and dealt with appropriately if doctors use tools. Suggested tools. In the defense of doctors, the system is set up to reward quick, simple visits and undervalues and underpays for the time, effort, and expertise required to provide high-quality medical care to complex patients, those with multiple difficult problems. And patients with chronic pain usually fall into this category. Several changes are needed in our healthcare system, including making it feasible for doctors to spend time with patients and provide the education and monitoring which are part of any safe program of pain treatment. I enter this discussion with significant experience and education. I've been not only a physician, both before and since recovery from addiction, intimately involved in the care of patients caught up in these issues, but a chronic pain patient myself, a patient with chronic pain treated with opioids, a person who became addicted to both prescription and illicit opioids, lived the dereliction of addiction, was fortunate enough to get clean, a person in recovery for several years, and now an advocate for addicts in recovery and those who are being harmed by the system, which is afraid of addiction, does not understand it, and is doing more harm by a draconian response to the opioid problems of the past. If you are a patient with chronic pain who has found that opioids are a key part of giving you the quality of life, that they help you function without serious side effects and without any history of abuse or addiction to your opioid medication, then you are in the majority of chronic pain patients treated with opioids, and you need advocacy and a voice. If you have chronic pain but also believe you have a tendency toward addiction, don't lose heart. You too can be helped, but that help looks a bit different. There is a video forthcoming, if not already published for you, quote, dealing with chronic pain when at high risk for addiction. The ugly truth is that people like some of you who are being cut off from long-term opioid therapy for chronic pain, when historically opioid therapy has proven necessary as a backbone of your treatment plan and has benefited you, stopping opioids is associated with several unpleasant, risky, and even dangerous consequences. You have a right to know this, which is why I'm making this video. Despite the reality that opioids do cause problems for a small part of the population, including myself. As detailed in other segments, abruptly or even gradually stopping opioid medication will cause most, if not all, persons to go through opioid withdrawal, potential medical complications of opioid withdrawal, risk to health and life, and beyond that, to the likelihood of return of chronic pain at a higher level, possible limitations in function, a syndrome called post-acute withdrawal syndrome, high risk of depression and suicide, and even a risk of a turn toward illicit opioids or opioids from a different source than a healthcare provider. Thus, both in the immediate and long term after your opioids are stopped, there are major risks. What makes this even more scary is the fact that most physicians and others in leadership and oversight do not even realize how serious this is. Your healthcare provider who is making this change is, at first, unlikely to appreciate the seriousness of the consequences to you. I was taught in my medical training that opioid withdrawal was like the flu, and something anyone of true grit and character could surpass. This is absolutely untrue in my experience. Withdrawal is much worse and can be life-threatening. You have a right to know what is expected to happen to you in the immediate and long-term aftermath of your prescription being involuntarily stopped. If opioids are voluntarily stopped or just for a justified health reason, many of the same challenges must be endured. The next video on this topic, quote, cut off consequences of opioid cessation, details exactly why stopping opioids is often a mistake and what those consequences are exactly. And the following, entitled, quote, cut off, how to survive involuntary opioid cessation will guide you towards surviving through this process. See you in the next segment.